Well, I know that your problem with sleep was actually kind of your main symptom that brought you in here. But it sounds to me from everything you're telling me that in fact you're also having symptoms of depression and anxiety as well.
Yeah, it's been, I don't sleep well. I have a lot of racing thoughts, and I get anxious over little things and just seem jumpy and
Yeah.
can't quite settle down, and I don't know why. And sometimes I just feel like I want to bawl, and there's no reason for it that I know it.
Yeah. Well, I think what I'm going to suggest today, we'd already talked a little bit about some of the medications that we might use for you. I think Lexapro is going to be a very good choice.
Okay.
And I've actually got samples that I can share with you, so we can work with that. I am going to have you fill out just a couple additional questionnaires for me. One is actually a brief screen for bipolar disorder. It's called the MDQ, Mood Disorder Questionnaire.
Okay.
And a little bit more in-depth questionnaire, just reviewing what other mental health issues you may be having right now. Only take you about 4 minutes to do these.
Okay.
When I'm out of the room, I'm going to be getting Jennifer Sales. She's our behavioral health consultant. She works right along with me. Usually like everyone to at least meet her. You may think after meeting her and talking a little bit that you'd like to have a few visits with her as well to work on some of this stuff, because there's behavioral things you can be doing as well as just medication, and we find people get well faster if they do both.
Okay.
So I'll go ahead and get her and give you the questionnaire to fill out here.
Okay.
And I'll be back in about 4 minutes. Well, Jerry, I did look at all the questionnaires that you filled out for me, and the happy news is I think this is actually pretty straightforward, just depression with some anxiety, and should respond well to the medication I mentioned. Your bipolar screening test, the mood disorder questionnaire. Fortunately, that was completely negative.
Okay.
And that's actually...
I have to go to the funny farm?
No.
Thank you, sir.
Yeah, so I think what we've talked about in terms of medicine, I think you're going to be real happy with. This is Jennifer Sales. She's our behavioralist.
Nice to meet you.
And we work closely together when we have someone who's dealing with depression or anxiety, because she can often offer you behavioral techniques that are going to be helpful. So I thought it would probably be good just to let the two of you talk a little bit, and then you can decide whether you'd like to continue with some visits with her. And of course, you already have your visit scheduled with me to come back and have us talk again.
Okay.
Very good.
Thank you so very much.
Yeah, take care, Jerry.
You too.
Hi.
Hi.
So you've been feeling depressed?
Yeah, for quite a while.
For a while, okay.
It seems to, little things get me down. I can't get up. I don't sleep well. And just anxious over nothing and everything, kind
Oh, okay. So that can be pretty distressing.
of. Yeah.
Yeah, hard to enjoy life when you're having all those moods and that anxiety.
Yeah, and you just sort of wonder about yourself.
Okay.
You know, I kind of question my mind, you know, is it right or what's going on?
Okay, well, I think in addition to I think the medication is really going to help you. And what we do in the behavioral program is try to kind of explore a little bit about the ways you think about things, some of the thought patterns that you entertain on a regular basis. Sometimes they've shown that, you know, when you're constantly entertaining negative thoughts, they can actually increase your depression or other negative feelings, you know. So we kind of want to explore what you're thinking about on a regular basis. And
How many times I want to take the trip to jump in the lake.
Okay, so
like
sometimes you even feel like taking your life. Sometimes, yeah, okay. Well, again,
Those get really ugly sometimes.
yeah, okay. Well, there's a lot to talk about. And again, I think on an immediate basis, the medication is really going to help your mood slowly come up. But there are also some concrete behavioral things that we can try, especially for the anxiety. we want to help you feel calm and relaxed, and there's some things we can do in terms of breathing, muscle relaxation, meditation, and then just talking about how, if your life is balanced right now in terms of the activities that you're doing.
Oh, I see.
Just kind of look at what you're doing socially, maybe.
Not much.
Okay. So we kind of want to just try to balance out your life, or just look at how we can improve on that, and that can help your mood too. So just explore a number of areas, and I'd be really happy to meet with you on a regular basis for a while here.
Okay.
And I'll probably be asking you about side effects of the medication as well, and Dr. Van Houten and I will be conferring regularly about your progress.
Figure out how long I have to take these pills and things forever. Or...
Yeah. Well, we hope it won't be forever.
Okay.
Really want to keep you on it long enough where it has its desired effect.
Okay.
So we're working as a team here.
Okay. I think that will help. I hope.
Okay, good. All right. I
Thank
look forward
you.
to meeting with you. Okay.
Thank you.